Hello, everybody. This is Dr. Kamel again, and a new content related to physical therapy license exam preparations. If you didn't see any of my videos before, my name is Dr. Kamel. I'm working as Associate Professor of Physical Therapy in the United States, and I am a licensed physical therapist in a number of states. Also, I am a licensed physical therapist in the UK and in Egypt. I have got my PhD from University of Nottingham from the UK. So let's explore today's content together. An older adult patient is observed during a stair ascent, going upstairs. The physical therapist notes that the patient leans forward excessively. Why the patient is doing that? Demonstrating increased hip flexion throughout the task. So the physical therapist is doing like analysis of the movement pattern of this patient during one of the functional activities, which is stair ascending, and the patient is leaning forward too much, doing too much hip flexion as well. So what? Why? This compensatory strategy most likely allows which of the following muscles to function at a mechanical advantage. Is it rectus femoris? Is it tensor fascia lata? It is semitendinosus. It is lumbar paraspinals. You know, in BT license exams, they don't ask you about the origin or insertion or something like that. Here we are talking about functional activity, and they are interested to know if you understand the function of each muscle, the attachment of each muscle. But so which one is the answer for this question? So the answer is tendinosis, and let's explain why. When the patient is ascending stairs, okay, hip extension is the primary movement required to lift the body upward. Okay. So, what are the main hip extensors? These are gluteus maximus and hamstrings. And we know that semitendinosus is one of the hamstring muscles. So you need to know what is the hamstring muscle, semitendinosus, semimbrons. You need to know that. So why semitendinosus is correct? The patient is leaning forward, which will increase hip flexion, okay, which will place the hamstrings, and one semitendinosus is one of them, in a more lengthened position. Okay. So if this semitendinosus, which is the only option in this question among the hamstrings muscle, in this more lengthened position due to increased hip flexion or leaning forward like our patient is doing, then this will improve the length tension relationship. And if this is happening, this will allow the muscle to generate more or greater force for hip extension. We need hip extension, right? So this is very important in older adults because sometimes they have weak gluteus maximus, reduced power generation. So they try to compensate by leaning forward, increasing the length or of the hamstring, and improves the length tensor relationship. And this will recruit hamstrings more effectively. Okay. So this is the explanation why among the four options, semi-tendinosis is a correct option. Let's look at the incorrect options. Okay. Rectus femoris. What is rectus femoris? Rectus femoris is a hip flexor and knee extensor. It is a two joint muscle. So forward lean does not enhance hip extension via this muscle. Yeah, very clear. Tensor fascia lata. The action of this muscle is assisting in hip flexion, abduction, and internal rotation. So it is not a primary contributor to stair climbing extension. And we said that the stair extension is important for stair climbing. Lumbar paraspinals. These muscles help maintain trunk in extension posture, erect spine. So do not significantly contribute to hip extension torque. Okay. So by understanding the action of each muscle, we can here, select the correct answer. So forward trunk lean during stair ascent is a classic compensation for weak gluteus maximus to shift the demand to the hamstrings. Okay, this is a clinical point we need to take from this question. So the hamstrings here are hip extensors, which are more active when the hip is in flexion due to the length tension relationship I just explained, especially in functional activities like in stair climbing. So in this case, the patient flexes the hip, placing the semitendinosus on a stretch and increasing its moment arm and increasing its ability to produce hip extension. Therefore, the patient is leaning forward to maximize the ability of the hamstrings to extend the hip during stair climbing activity, and the other muscles would not give the same benefit, like the semitendinosus. This was the explanation of this tricky question. Okay. If you would like to join my BT license exam preparation course, please send me a message on this WhatsApp number 001442248720 or 00201027743702, and I will send you the details to join. Also, those graduates who are interested in applying and joining the transitional DBT program at University of Montana at a discounted rate, please send me a message on the same number and I will send you the required documents and details. I'm sorry that I cannot answer some of the question which is sometimes be sent to me, as some of them are nonsense and some of them are I have repeated this information many times, and I have posted some content on the YouTube channel and about the answer of this particular question. Thank you so much for encouraging me and for listening to my content. And if you can kindly share this channel with your colleagues, either graduates or students, will be much appreciated. And see you soon in a new content.